back to our second Zoom session around preparing for labour. And we would like to welcome you, and we've got Jan back and Gabby and Lorena. So we're going to just be covering some topics around how to prepare for labour. So I just wanted to open up and really ask Gabby what your thoughts are about a birth plan for labour and what you need to do.
Yes, so a birth plan is one of the things that I always talk about with expectant couples during a hypnobirthing course. And I talk about it in a slightly different way. Rather than talking about a birth plan, I tend to talk about a birth proposal, because in life we never know exactly what's going to happen. To say that it's a plan sounds a little more rigid, and then one could be disappointed if the plan doesn't go exactly to plan. So I think of a birth proposal as being able to put down, you discuss it with your birth partner, you can discuss it with your midwife or whoever's going to be looking after you and helping you. And then it's like a set of requests, instructions, communication, so that when the big day or night comes, you don't have to be focused on telling other people around you what it is that you want. It's already documented there, and you can do it however you want. You can write it as bullet points. You can actually access online lovely pictures. You can have a visual birth plan, which I think is really lovely. And, you know, there's little pictures saying who you want to cut the baby's cord and all sorts of information that you would like whoever is looking after you to be aware of. You know, like, do you want whoever's caring for you to be actively talking to you all the time, or do you want them to sit very quietly, you know, sort of just there if you need them?
I love these suggestions. Yeah, I think
I always think of it a bit like if you went to a restaurant, and if you went to a restaurant and you said to the waiter, just bring me whatever you want to bring me. Now, you might get the most wonderful meal that you really love, or they could bring you everything on the menu that you really don't like. So it's a way of communicating so whoever is helping you can actually help you in the way that is best for you.
I like the idea of not calling it a plan as well, because in some respects, when you say it's a plan, it's that added pressure, isn't there, that there might be some failure behind not achieving what you planned to happen. And it shouldn't be about this is the way it's going to be. And I know friends of mine that in their first pregnancy, that was a big part of the pressure of the labour, that things weren't going to the plan. And in their head, they were almost failing on what they set out to do. And I mean, I remember walking the moonwalk, which is 26 miles in your bra around London. And we had trained and we knew it was going to be this amount of time, and we had a plan in our head. And then when we set out and things actually weren't how it was meant to be, it just derailed me particularly. And I just couldn't get out of my head that we were going slower, stop starting, and I just mentally kind of lost it. Whereas my friend who was doing it with me just hadn't really planned for anything, and she was a lot more relaxed about the whole thing. She had an idea of what was going to happen and was quite willing to have those changes. Whereas for me, she said, I just became a nightmare at 2 a.m. because I wasn't hitting the times I wanted. And I just couldn't talk to her at that point and just switch. I think that's the same in birth. You need to not maybe plan and fail. You need to prepare, don't you? And be willing to have changes.
Yeah, and I think it was so different for me when I had my children, because I was a midwife. I didn't actually have all those expectations of exactly, because we saw every kind of birth that could happen. We were very aware that we will go into labour and, you know, sort of see how things go. And I suppose we were very, very lucky because we had our friends looking after us. So we wouldn't even need to necessarily tell them, you know, they would know how to support us and look after us. So
Yeah.
that's kind of how I
So
think of it.
thinking about that kind of preparation, Jan, you really recommend perineal massage. What is perineal massage, and what's the research around it to help you towards that labour?
I think most women don't like to talk about this subject, but it is getting better. I've noticed in the past 6 years. But at one stage, if years ago, certainly nobody would talk about the perineum. And just to explain where the perineum is, I'll just have to use my hand. If that's the vagina, that's the perineum, and that's your bottom. So this is the perineum. And this is the bit that can tear, and everybody hears about awful things that can happen to you. So you're anxious about it already. I think knowledge is power as far as this goes. If you do a massage, first of all, if I say about the research, they put 4 trials together, and that was just under 2,500 women. And that showed that the women who massage from 34, 35 weeks of pregnancy, and that's the perineum where they massaged, were less likelihood of tearing or not tearing at all. And 3 months after the birth, they felt more comfortable. So you've got the benefits, we've got the research as well. So if you use good oil, I don't know where I put it, excuse me. Anyway, if you use a good oil to use for on this area, there's no essential oils in the down below bottle that we use for motherly love. You don't want any essential oils at all. There's jojoba and there's avocado and there's some grapeseed as well. The jojoba and avocado, they are very, very high quality oils. They've both been used for psoriasis and eczema. So sensitive skin, and we're using something for the sensitive area as well. And jojoba has been shown that, and this is scientifically, that it will absorb into the skin, but because the chemistry of jojoba is very similar to your own sebum in your own skin. So what you're doing with a massage is, and if this is the perineum, you're actually massaging the oil in there, and it will absorb. So it's the massage and good quality oils. And if you are doing the massage, you're using both thumbs together. If you have the partner to do it, he'll use the index fingers. So at first it might feel a bit tender, so you don't want to be that rough. You need to kind of go into it kind of gently and then increase, because it's kind of 2 to 3 times a week. And then you can go up to the sides as well. I think there is only one thing I can say about it. It's not going to harm you or the baby, but if you have an infection, say thrush or some other infection down there, stop from what you're doing, go to the midwife or your maternity hospital, the consultant or somebody, and just get it all sorted, and then you can actually carry on afterwards. So I find that ladies even who have had episiotomies before, and actually the benefits are that it actually reduces episiotomies, but we don't often do episiotomies these days. But the ladies who have had episiotomies previously, they can also break down the scar tissue. And I've had quite a lot of good results with that as well. So the benefits are great for women. It gives them confidence to birth their baby, which is so important.
That's great. I know people who have used the massage oils during prior to giving birth, and after having quite bad tears for the first birth, and really benefited from them. And just doing the perineal massage is definitely something I know you've advocated a lot with them, and definitely seen the benefits from. So Lorena, as we're talking about massage, it'd be really interesting to know what the research is around the benefits of having massage in labour, and your thoughts are around this.
Yeah, so hi, I'm Lorena. I worked as a midwife for almost 28 years at Queen Mary's with Jan some of the time, and also Gabrielle. So we know from the research that massage has an all-over body effect. It affects you emotionally, physically, psychologically, neurologically, and chemically. When I wrote a degree paper on the benefits of massage in pregnancy and labour, I had to read a huge stack of research, and the findings were so astounding that that's what led me to leave midwifery and go and train as a massage therapist, because this is what they found. They found that ladies that had massage in labour tended to have a quicker, less painful labour. They had less agitation and anxiety in labour. They had a shorter hospital stay after the delivery, and they had less postnatal depression. The babies were also born in a better condition. So they had a better APGAR score. So the APGAR score is like an assessment that the midwife or the paediatrician, whoever's looking after the baby at delivery, will do at 2, 5 and 10 minutes. And what that does, it looks at colour, the baby's colour, its heart rate, its breathing, its tone, and its reflexes. And one of the reasons that the babies are born in a better condition if the mother's had a lot of massages, with the massage, they tended to have less other sort of formal medical pain relief. And there was a huge study done. I don't know if you knew her at Oxford, Jan, but there was a midwife at Oxford at the John Radcliffe called Linda Kimber. And she trained at the massage school where I trained in London long before I did. And she did a huge research study. I can't remember the year. But basically, she taught birth partners, which is what I do. She taught them a program of massage at the end of pregnancy, and then they practice from 37 weeks onwards to use when the women go into labour. And what they found is 1/3 of the first-time mums on that study actually had no other pain relief than massage. They didn't feel they needed any, which is really quite an astounding finding. So having the massage doesn't preclude you from using other pain relief at all. In fact, I'm not a brave person. I would say you just have whatever you need to get you through. But what we're all talking about today is things that will help the mums to get through. It's all different tools to use, and they all work beautifully together. The massage, the hypnotherapy, and Jan's aromatherapy oils. One of the other findings that they had, which I think is slightly surprising, I think it surprises the couples that use the massage, is they actually found that the couples that used massage felt empowered, and they had a much more positive birth experience. And I've been teaching the birth partners massage for a long time now. And sometimes I don't see them between having one baby and nearly having the next one. So it could be 2, 3, 4 years or more. And when I do go back, that's tends to be when they give me the feedback, and they say things like, my husband's rubbish when I'm ill, and I thought it was going to be not very good in labour. If I've ever asked for a massage, you just grabs me and it's too firm. But what they say to me is, it was brilliant because you came and taught him, and he knew what to do. He was really useful. It gave him something really positive to do. And I think it's just really nice that the couple feel that they're actually working together for the birth of the baby, that the birth partner's not just a bystander. He or she is actually really contributing to that experience. So I get really excited about it.
I think it's really interesting that you talk about all the research, because actually I didn't realise myself about all the research that there was that showed such a positive outcome. And 10 years ago, well, actually 13 years ago with my first child, we used massage during the labour. We used my Jan's products, the Motherlylove products, but actually all those points that you made around helping with reduced medication. I actually was lucky enough not to need any medication during my labour. It was a relatively quick labour. I was very relaxed. I was at home. It really made Russell feel as if he was part of helping support me, because he played an active role. And those pieces actually that you say they found in that research, I definitely experienced during my first pregnancy. Now, I know it could have been very different, and I was very lucky in my first pregnancy and during the labour itself. But I think it's really testament to say that these practices are really research-led as well now, and there's so much evidence behind them to say that they're important to take part in during labour, and also, you know, actively engage in what can help support your labour and make it better. So it's great to hear all that research behind it as well. I was just going to ask Gabby, with regards to hypnobirthing and labour, what's your thoughts around planning with hypnobirthing and when to use it during the labour? And also, who decides where you give birth? Because that was one of the things that you were sort of talking about earlier. Who plans to where you give birth?
Okay, so if I answered that one first, who plans where you give birth? I think the quick answer is you. Every trust is set up to, they have to offer you a safe place to have your baby. There was a big study done called the Birthplace Study that was published in November 2011. And after that, trusts have been set up basically, usually with an obstetric unit where the doctors are. There's midwives as well, but that's where they kind of live. So anyone with other medical needs who's pregnant will be advised to have their baby there. Then there are midwife-led units. Now these vary around the country. Sometimes they're in a hospital, sometimes they're independent, like Maidstone, where Jan used to work. That's the one that's local to us, an independent standing midwifery-led unit. And then there's home birth, which a lot of people choose. So the quick answer is you choose where you're going to give birth. Sometimes the care professionals will try to direct you down a certain path, but if you're not happy with that, you can negotiate with them, you can ask them why they're suggesting a certain place, and it is your choice after all. And some people will choose to opt out of that system and birth at home with an independent midwife. I think one of the things that I would say in this area is, if you're ever unsure, there's a wonderful charity called AIMS, the Association for Improvement in Maternity Services. And they look at all the research out there about childbirth and put it together in really easy to read format. And you can download some of their books, or, you know, get the books sent to you. And they even have a helpline. So if you're ever unsure and want some sort of independent advice about a situation, I've always got their books with me when I'm teaching hypnobirthing. This is an older edition, Am I Allowed? It's got a new name now. I can't remember what the new name is, and I've got to get it. But basically, it tells you that it's your birth, it's your baby. You know, it's for you to choose what you want, and for other people to support you in that process. The other thing you asked, I think it was when you can use hypnobirthing, wasn't it?
Yeah, I rolled two questions up into one, sorry. It was really around when can you use hypnobirthing?
Memory.
Or what we can do is we can go on to that one if you would like, and I can ask Lorena or Jan.
Okay, yeah, no problem.
I don't mind. I was kind of testing you there with two at once. So Jan, we just discussed, you know, about the fact that you can choose where you can decide where you give birth. I remember being in my living room and then being told, oh, maybe you want to go up to your bath. And I was like, no, I'm not moving. But there's also, there are benefits of water birth. And I did look into it at the time because I do love the water, but it was something that I didn't actually end up going for. But I know a number of friends who have had water births, and I just wanted to understand what the benefits of water birth was, and can you use aromatherapy during water birth or not? Those number of questions there.
Okay. I'll try to remember them, Jess. Yeah, water births. I was lucky enough to be at Maidstone Hospital when they were starting water births. There was Michel Odent, or Odent, I don't know, he's a Frenchman in Pythias, and I don't know if I've even said that right, but he was doing water births in France. And this was, I think, about in the 1970s. So when we started in Maidstone Hospital, we did have a birthing pool on the maternity unit, and I delivered quite a few babies and that were in that pool, but also at home, because you can actually keep at home. You discuss water birth with the midwife first of all, because you have to, is certain kind of criteria that allows you to go into the water. As far as aromatherapy and massage, usually the lady labors until about 4-5 centimeters. 10 centimeters you have to go to. So it's kind of halfway there. Then she can go into the water. So up to that stage, you can use aromatherapy and massage. As Lorena says, you can do a back massage. And the oils, usually, you can use quite a few different aromatherapy oils. The one that I'd use on a back massage is Roman chamomile and a mandarin. The mandarin is helping to calm and relax the lady. And also the Roman chamomile is good for calming, but also for muscular and joint pain. But we at Maidstone used to wash the back and make sure that when they go into the birthing pool, there was no essential oil. And Diane Garland looked into this. She's a very good expert midwife on water births, if anybody wants to look at her research. And it's very calming. The benefits are that actually you can move around in the water and be in different positions. It's a calming kind of birth. Usually you have, they've got different birthing pools in different hospitals where they have nice lights, and it's really taken off. And I think lots of the ladies are worried that something's going to happen to the baby as it births, but the water is kept at a certain temperature, so the baby doesn't take a gasp of water or anything, and will only take a gasp of air when it's brought up and put on the mother's tummy. So I think even at home, which we've had water births at home, you have to hire the water at the birthing pool though. But it's a very, very nice. So that's kind of the extremes. I'll talk about cesarean sections in a minute, which is totally different. Yeah.
So Lorena, we sort of looked at, Jan mentioned about pain. So how does massage actually help your labour with pain relief? Is it something that you recommend? You know, how does it help reduce pain during labour?
Yeah, so I would highly recommend it. So the science behind it is this, and this is what we know from the research. So when you have massage, your body releases endorphins, which are the things that you release when you exercise, that most people have heard of, that make you feel all calm and happy and chilled out. And they also have like a pain relieving effect. But when you have massage, your body also actually relieves something called the brain releases enkephalins. So enkephalins are 200 times stronger than morphine, and they are morphine like substance. So with the massage in labour, you would start in early labour. Some people say you need to have continual massage throughout labour. That's not actually a research-based thing. 20 minutes out of every hour is enough, because the person doing the massaging would be absolutely exhausted. But you get a build-up of these enkephalins. So they're all going around in the blood, the endorphins and the enkephalins. You've got that lovely natural morphine. The second way is the relaxation and the improvement of circulation to the tissues, the uterus, the cervix. So when you get stressed and anxious, your adrenaline levels go up, and then you get this fight or flight reflex that most people have heard about. So when you get really stressed, lots of blood goes to your heart, your lungs, your arms and your legs. So you can either fight or you can run. And there will be enough blood going to your other organs, but not as much as ideally you would like, not the optimum. So what massage does, and we know this from research, it reduces the adrenaline levels in the mum and also in the baby. So it brings those adrenaline levels down, it boosts the circulation, so you get a better circulation to the whole body, to all the organs. And one of the things that is associated with a less good circulation to the tissues, and that's called ischemia. One of the things that is associated with that is pain. So like a really severe form of that would be if you imagine frostbite, because you're not getting any circulation to the tips of your fingers and your toes, and they become very painful. So the massage actually just improves the circulation, reduces the adrenaline, and that really helps with the pain. It helps the uterus to work properly, and it helps the cervix to be soft and to dilate. And that's what you want. Once you start on this labour road, you want to get to the end in a nice, timely fashion. You know, it's like the marathon. You don't want to be finishing it 2 days late, you know. So, and then the third main way, the scientific thing, was they did a massive study in 1965, somebody called Melzack and Wall, and it's called the gate control theory. And it was like this research, but I'm going to put it in a couple of sentences. So what they found was, they found that the stimulus, the feeling from touch, from massage on your skin, is picked up by the nerve endings. It goes up the nerves, into the spine, up the spine, and it comes up to the top of the spine, to the brain, and there's a hypothetical gateway there. So what they found when they did this research was that the feeling from the massage, the stimulus from that, it reaches that gateway first and it closes the gate. So people are still, it may be in discomfort, some people might describe it as pain, but because that gate is closed, and because the feeling from the massage reaches that gate first, the brain doesn't recognize the pain and discomfort. It's got that gateway's been closed to that. So that is that's a really big, massive bit of research that explains how the massage stops the pain. And I always explain this to the birth partners when I'm teaching, because I think sometimes they think, oh, she just wants, you know, she's having a laugh, she just wants a bit of massage through labour. It's a way to get me to do it. But they're going to get tired doing the massage, the birth partners. But if they really understand the science behind it, if they really know it's not just something that feels nice, it does actually clinically, scientifically reduce the pain, then I think it encourages them to carry on to the end.
That's so interesting to know, isn't it, that actually there's a science behind why it's stopping you feeling as much pain or reducing that pain. And I think I definitely noticed the difference with massage during my labour. And I think that obviously hearing that from yourself and all that research behind it is really, really useful to know. So with regards to hypnobirthing, is hypnobirthing something that you would look at just for natural birth, or can it be used in any birth situation? Because people they go through many different routes to having their baby come into the world. So it'd be interesting to know, Gabby.
Yeah, absolutely. I teach hypnobirthing to everyone, no matter what type of birth they expect they'll have, because as we actually discussed earlier, we don't always know exactly what's going to happen. Hypnobirthing is a whole birth preparation. So a little bit like Lorena described, when a couple do a hypnobirthing course together, they learn together, and the birth partner is very involved in the whole process. And the aim is very similar to the massage. It's so that the mum feels safe, and when you feel safe and calm and relaxed, then that fight and flight doesn't kick off, and then the body can do what it needs to do naturally. So the sort of principles behind it are to enable a calm, confident birth. But those principles can be used in any situation. If someone is expecting to have a cesarean, then there are still lots of things that I can teach them about, you know, requesting certain practices during the cesarean. For example, the peripheral, obviously they need the lights to see what they're doing, but the peripheral lights to be dimmed. So that when the baby is born, you know, it's not a sudden shock to the system. They can still baby be born and come up and have skin to skin, unless there's a medical reason why not. I've taught people who've had twins. I've taught people who've had planned home births, unexpected home births, water births, every kind of birth you can imagine. It's like an education program that prepares you for birth, as opposed to one particular kind of birth.
That's fantastic to know, and it's really good to know that it's so useful to do the hypnobirthing to prepare you as well, and that you can use it in different scenarios and situations. So Jan, with regards to massage and having a cesarean section, if you're having a cesarean section and it's planned, can they use aromatherapy and massage antenatally and postnatally?
Yes, you can. And I think there's kind of benefits for aromatherapy massage for cesarean section, because every birth, you want a nice calm lady anyway. With I think to start off with, antenatally, it's good to have a bath oil. The one that I blended is with lavender and cypress. And lavender, we all know that it helps with sleep, it helps to calm, but it's also an antibacterial. So that is good for after the birth as well, because that helps if it's an antibacterial as far as healing goes. Cypress is great because if you have hemorrhoids or varicose veins, it helps any swollen bits. And again, after the birth, it's very good to. So those blends together are a very nice combination before the birth. But after the birth, I always say, if you want to have a bath, feed the baby, then hand the baby over to your partner and go and have like a spa little bath, and just take your mind off all the worries and everything. And that's really, really helpful. There's also been, interestingly, with the massage, there's a Turkish massage, and I can't remember the name because it's in Turkish and I can't remember it. But the Turkish massage research showed, and it was with 280 women, and that showed that the massage, if you massage the hands or the feet, but the hands specifically, before was very good, just to reduce and calm the lady, and afterwards it was actually very good to actually reduce the pain level of the lady. So I think those combinations and understanding that, you could find a hand and arm massage on motherlylove.co.uk, my website, and you'll find it in the blog. And it's always helpful. You can use the lime essential oil blend, and yeah, that's a really nice one to have.
But we need to avoid the Turkish baths at all costs, otherwise we may come out slightly bruised.
I wasn't suggesting.
I know, I'm just messing.
Turkey.
I just, when you said about the Turkish massage paper, I just thought of experiences of Turkey and going to the Turkish bath.
Well, my experience was quite disastrous, because I was with all these young ladies and they were wearing, I said, what do you wear? And they said, oh, just wear your swimming costume. And all I got was a bra and pants. And when I got outside and walking down the road, I said to my husband, oh, that wasn't too bad. He said it wasn't too bad. And I said, well, I didn't feel exposed. And he said, you could see right through your bra and pants.
Oh, so that leads really nicely onto why is massage good for pain relief, Lorena? Is it safe and easy to do?
You know what Jan just said? Yeah, so massage, it is safe and easy. So it's very easy to teach effective basic massage technique to the partner, and I would do that at 37 weeks. So the brilliant thing about massage is not only does it feel great, but it's a non-invasive, drug-free, safe form of pain relief. We know that it relaxes you as well as reduces the pain, so that's positive. We know from all the research that it actually works. It's also good for the mums and the babies, so it will calm mum in labour. It will keep her heart rate lower than if she wasn't having any massage. And part of the things that they look at in labour with the babies getting distressed is the heart rate. So if a mum gets very agitated or anxious or anything else sends her heart rate right up, that will have a direct effect on the baby's heart rate. And we know that massage will help to reduce the heart rate, to reduce the blood pressure, to keep it at a nice beneficial level for the body. They can also use the massage. So if my ladies are going for planned cesareans, and I've probably been seeing them most of the way through the pregnancy, normally when it's not lockdown and I can see them, we will make an appointment to do a good hour's massage before the cesarean, as close to the date as possible. So often it would be the day before, the afternoon or the evening before, because it will just be some quiet time for them to focus on the positive aspects of the birth. I think people really look forward to cesarean sections if they're planned, if it's all planned nicely. I know I've got clients that have had such positive experiences, and I'm just going to mention Pembury Hospital here, because I know that they have the kangaroo cardigans that they can use at cesarean sections. So all the staff are trained, and they put these special cardigan wraps on the mum, so that when they have the cesarean, the babies are then posted into them and they can still do their skin to skin. So I feel concerned sometimes that cesarean section hasn't or isn't billed as a very positive birth experience, and I think it should be. I think any birth experience where you have a healthy mum and healthy baby and everyone's happy at the end of it, to me, that's the positive. That's what we're aiming for. It doesn't matter if your husband isn't hanging from the light fittings doing acrobatics to Mozart in a candlelit room when you give birth, as long as everyone's okay. So I would do the massage as close to the cesarean as possible. I can also do the teaching for the partners at 37 weeks, and Jan was mentioning hand massage, so I can teach them a quick hand and arm massage. And again, that's what a lot of my mums use when they have the water birth. So once they're in the water, they can still have their hands and arms done because they are often out, or they can still just have their neck done, or their foreheads can be stroked. So that all counts as massage. You will get all the benefits from that. You've still got the 20 minutes, an hour, you'll still get all the benefits. It all counts.
And I think, you know, any birth that's chosen, I know friends of mine that have elected for cesareans due to certain situations, and actually it's ended up being very positive, but it's about making it a positive experience in the fact that, like you say, the fact that you've got a healthy mum, a healthy baby at the end of it, but it's what you can do into the lead up to that to prepare for that labour and or prepare for that cesarean section, which will help you. And sometimes you can prepare as much as you want and situations happen not in the way that you expect. So it's great to have things that you can tap into and tools that you can use, such as like the hypnobirthing, or just tips around how you can adjust what you think you're going to do massage wise. So it's been, I think, some great tips and hints, ladies, around how to prepare for labour. What I'd like to do is, would you each of you be able to just tell everyone how they can find you and where to find you, either on social media or access websites, if you don't mind? I'll start with Jan.
My website is www.motherlylove.co.uk. I'm also on Instagram, which is motherlylove.uk. I'm also on Facebook. You'll find me in Motherly Love, and Pinterest and LinkedIn. I seem to be on everything, to be quite honest, but Facebook and Instagram is the important.
And Gabby?
Yeah.
My website is www.lovetofeelgood.co.uk, and also on Facebook, it's Love to Feel Good.
Perfect. And Lorena?
So my I've got Facebook, which is Pregnant Massage. I've got Twitter, which is @PregnantMassage, and my website is www.pregnantmassage.co.uk. I haven't got Instagram. Have we got time to say something really positive about birth?
Yes.
So I would just like to say, people tell you horror stories sometimes when you're pregnant. They tell you all the negative things and how awful it was. But I think it's really important to put the positive side. And I had 2 really nice normal deliveries, nice and quick, straightforward. And I'm not a brave person. And I think it's like what Gabby said when the girls were talking earlier as well. For us as midwives, going into a unit where we knew everybody and we felt really comfortable, and our friends were looking after us, which was fantastic. But having been a midwife and delivered hundreds and hundreds of babies before we had our own, we'd, as Gabby said, attended every type of birth. We'd seen every sort of thing that could happen. But if you can go in with a calm mind and a positive outlook, and not have everything, really interested in what Gabby said about the birth plan, like making a proposal. Don't have it set in stone. Just believe that the midwives that are looking after you, the doctors, they're there to help you through it and support you. And if you can go in feeling confident that that's how it will be, I just think it really helped you to get through the whole situation. Just to trust them and let them support you, because I think that's what all the midwives I work with at Queen Mary's, that's all we ever wanted to do, was to support our mums and give them, a really positive birth experience that they enjoyed as much as possible. And I have to say, I did enjoy my labours. I really did.
And I must say, I agree with you. From what my experience was, it was really positive. And I know friends of mine who overly planned and it didn't happen how they wanted. And the second one was far more positive because they were far more relaxed about it and they were less anxious around it. I think I was lucky. I'm not necessarily a planner. My husband wanted to have a plan, etc. I was more relaxed about how everything was going to happen. But I think having that input of support, trusting the midwives, trusting the people who are there with you during your labour, also being aware that people are there to help you and really being cognizant. I think that the massage, the birthing, and just listening to people really helped support me during my labour with the breathing. And it can be a really positive experience, but it's just, yeah, I think that's a really important bit. Don't focus on the negative from everyone. Everyone loves to tell you the bad pieces, don't they? But sometimes you need to actually focus on the nice stories and listen to the positive stories, and and have that as your experience. So I think that's great advice, Lorena. And also like to say that I know it's during COVID and everyone's a little bit reticent about going to their GPs and being a burden, as you sometimes think you are, because we're during a pandemic, or going to the hospital because people are a bit worried about going to the hospital. Your maternity services are always open. Your NHS is open for you. Your midwife is available for you. So please contact them as your first point of call if you feel that anything is amiss, you've got any worries, you've got any questions. Nothing they will think is silly or daft. They will always want you to contact them. So please contact them and go and have their number available in your phone, and phone them if you've got any concerns at all. Does anyone else want to add anything before we close up?
No, I just think look forward to meeting your baby. I think it's an exciting time. Yeah.
Great.
Yeah, thanks Jess.
Thank you.
Yeah.
Thank you.
And I think
Thanks,
Gabby will stop the recording.